All right, hello everybody. In this first Motor Learning Monday series, I figured we'd start off with the basics and define and differentiate motor learning and motor performance. So motor learning is one of those kind of buzzwords that you might hear or read a lot about. And while I think we're thinking about it in clinical practice, I bet what most of us tend to actually focus on are concepts related to motor performance. But these are two vastly different concepts. So motor performance is defined as the behavioral act of executing a skill at a specific time and in a specific place. So it's very objective, very measurable. Someone comes into a therapy session and we see exactly how they're doing at that point in that time. Motor learning is a little different. Motor learning is really kind of an inferred process. It's defined as the change in the capability of a person to perform a skill, and it really must be inferred from a relatively permanent improvement in performance as a result of practice or experience. So how do these differ? Okay, well, I think a very good example is in a therapy session, whether it's a session for voice therapy or airway protective therapy, working on cough and swallow function, even speech therapy, someone could be having or demonstrating very high performance, very high degree of accuracy, but not actually learning the task. They might come back a week or a month later and doing the task relatively inaccurately or inconsistently. Conversely, someone could have a very low accuracy within a therapy session, and there's lots of learning that's actually going on the back end of things, and they may very likely come back the following week and kind of surprise us with how accurate they are. And that's because motor performance does not necessarily reflect motor learning, and in fact, it can almost misrepresent it. So I think as clinicians, we are very oftentimes trained to think about facilitating something like 80% accuracy for a patient for a given task that we are trying to help facilitate to train. But I think this helps us to kind of not sweat the small stuff. If someone has low accuracy, it's not a bad thing necessarily. There could be lots of learning that's actually going on. So how do we know if someone is learning? Well, we can test that and kind of make observations through a variety of different measures. Certainly, we want to see improvements in the accuracy and consistency of performing a task. So can they do it correctly, and can they consistently do it correctly? But that's kind of the same thing as motor performance. So what we're looking at is a relatively permanent change in that. So are we seeing that across many sessions or multiple sessions? So that's one. Another is retention. So if someone stops practicing and then they come back a month later and we reassess them or they reassess themselves, are they continuing to demonstrate the skill accurately and consistently? So that'd be another metric, is that they're retaining the task given a period of non-practicing. A third kind of important measure would be generalization to similar but untrained tasks. So let's say we were teaching someone to use a smooth and efficient voice during reading of kind of continuous connected speech passages. Are they able to then carry that over to spontaneous conversation or during something like a sustained phonation task? We might have been training reading or connected speech, but then were they able to do it during similar but untrained tasks like sustained phonation? So I think in an example for airway protective therapy, which is cough and swallowing therapy, maybe we're training something like voluntary cough skill training. We're training strong and crisp coughs with minimal to no voicing. Are they then able to generalize that to something like reflex cough, whether we're doing reflex cough testing or whether they maybe aspirate during a wheeze or a phlegm and demonstrate that same type of cough? So that would be a similar but untrained task. So that would be generalization. And kind of a last marker for motor learning, certainly there are others, would be, can the patient perform this task when in kind of less than ideal circumstances? So maybe they're dual tasking, or maybe they're stressed out, or they're tired, or they're on meds. So something that kind of perturbs the system a little bit, are they still able to demonstrate that task as accurately and consistently? And certainly that's everyday life, right? And so we might be incorporating things like dual tasking into our assessments of the exercises. So, and that may explain why someone might perform not well within a given session, but they've actually learned the task really well. So, or relatively speaking. So there's lots of reasons why someone may or may not do well or not well within a session, and that's why it doesn't necessarily reflect motor learning. Okay, so my take-home messages for this first kind of mini-series message is, as speech pathologists, we should really be caring probably much more about motor learning than motor performance. So again, it's buzzwords that we're using, but are we actually thinking about metrics for motor learning, which is in fact a inferred process, and do we kind of emotionally place a lot more weight on motor performance? Hopefully not. Low performance within a session could be a good thing. So let's worry a little less about if someone is not achieving 80% accuracy, and a little bit more about, are we facilitating kind of error processing and the patient's ability to kind of troubleshoot and learn a task. And as a result of this, we should really be incorporating assessment and treatment techniques that facilitate and look at motor learning in our therapy sessions for voice, cough, and swallowing therapy. All right, take care, everybody.